Well, Colorectal Cancer Awareness Month is wrapping up, but the urgency to get screened is year-round. As the second deadliest cancer in the U.S., colorectal cancer, or CRC, will impact 1 in 24 people with a diagnosis during their lifetime. Last time she was here, Dr. Hailey of HCA Midwest Health told us the signs and symptoms of this highly preventable disease. So today we want to focus on screening for CRC, which could save your life or someone that you know. And Dr. Hailey, thank you for being here. What do you mean, first off, by this is a highly preventable disease? What exactly does that mean?
You know, we mentioned that last time. It is highly preventable and treatable, but you have to look for it. And we do this through screening colonoscopies and at-home fecal DNA test kits. And we recommend starting at age 45 now, and earlier sometimes for people who are at higher risk. People with inflammatory bowel disease, such as Crohn's disease, ulcerative colitis, or a family history of colon cancer or early polyps. You ought to talk with your gastroenterologist or your primary care physician about which test is right for you and what age to start.
Now, these screenings kind of get a bad rap, and I feel that's because of the prep that goes into it. The actual procedure itself is very easy, but let's talk through the whole process. What do folks need to know? Like, they don't want to get it done, you know, but it's really not that bad. Talk about the process.
Sometimes it seems like the hardest part about a colonoscopy is the patient actually making the appointment and keeping it. I've had patients cancel theirs multiple times in a row. But honestly, the hardest part is the prep. Speaking from experience, don't start it at work. But it is a simple and safe procedure. A doctor uses a tube with a camera and a light on it to detect and remove polyps. 9 out of 10 people are still alive 5 years later if their colon cancer is detected early.
That's awesome, and and I think that's a testimony to that early screening process. You get it, you find it, you can take action right away, and then, like you said, that statistic there, very preventable, very beatable cancer.
Yes.
Awesome. Well, what exactly do the doctors look for as they're using the camera and the light? What are they looking for as you undergo the procedure?
Well, colorectal cancer most commonly develops from abnormal growths in the colon or the rectum, and a colonoscopy finds and detects and removes the small polyps before it becomes colon cancer. Screening colonoscopies can also find colon cancer early, making a cure more likely. So your gastroenterologist afterwards will determine how often you need a colonoscopy, depending on how good your prep was, the pathology of any polyps, and what your family history is.
Yeah, finish the prep, just from example. Finish the prep. So last time you were here, we talked about CRC and stressed that it's a cancer that often develops few, if any, symptoms, which I think is another good reason that you should get screened. But what symptoms should we be aware of that might raise a red flag? And I need to call my general practitioner or my gastroenterologist. Enterologist.
I know, your GI doctor.
Missing a syllable there, sorry.
I love it. You know, colon cancer or colorectal cancer is considered a silent killer because it often presents without symptoms. But symptoms can include a change in your bowel habits, constipation or diarrhea, bloody or black tarry stools, abdominal pain or discomfort, a feeling of fullness after you've eaten or bloating, anemia, generalized weakness or fatigue, and unexplained weight loss. So if people are having any of those symptoms, I urge them to talk to their doctor.
And what alarms you the most about the fact that 1 out of 3 patients in the U.S. are not getting screened for this?
Well, despite being highly preventable, recent data shows that it's become the deadliest killer for both men and women ages 20 to 49. And this latest data also indicates that young onset colon cancer increases 2% every year between the years 2016 and 2020. So CRC is no longer an older person's disease. And we need to raise awareness for younger people that they're at risk too for developing colorectal cancer.
And like you said, to start things off, that age has been dropped from 50 to 45. So definitely something to be talking to your general practitioner about, or your GI doctor. So, and if you need to find a doctor, the closest ER and urgent care to you can always go to HCAMidwest.com. And of course, Dr. Hailey, we always appreciate you being on the show. Always bring a lot of great insights, a lot of great facts for people to know and check out. So thank you for your time.
Thank you.